Traumatic events do not always leave physical marks on a person. More often, they leave emotional and psychological scars. These scars can affect a child's mental and physical health in the years to come and even into adulthood. Therefore, do you know what parents can do to support a child after trauma?
Laughing at me on the damn inside. I'm the fucking sucker.
Adverse childhood experiences include traumatic events such as abuse, witnessing extreme violence, experiencing abuse, or natural disasters. Additionally, events like bullying at school or the loss of a family member can traumatize a child. Parents should be aware that an event may not be traumatic for them, but can have a different impact on their children. Therefore, parents should be extremely vigilant. The immediate effects of a traumatic event may not always be visible in many children. However, certain factors can increase the likelihood of future problems. Trauma can affect children at any age, but those who experience adverse events before the age of the 8th of May be more vulnerable. Every child experiences trauma differently. Some children may be less affected by major stressors, while others may be more affected by seemingly milder risk factors. The more severe the trauma, the higher the risk of lasting difficulties. Repeated exposure to traumatic events can increase the risk of long-term health problems. Children who repeatedly witness violence or experience abuse have a higher probability of experiencing long-term problems compared to a child who experiences a one-time event, such as a car accident. Past traumas can persist in a child's life and negatively impact their physical health. Children exposed to traumatic events have a higher probability of experiencing health issues such as anxiety, cancer, depression, diabetes, heart problems, obesity, post-traumatic stress disorder, stroke, substance use disorders, and others. There are two main ways that trauma can lead to the lasting effects mentioned above. The body tends to respond to emotional stress with physical reactions. After experiencing physical head injuries like concussions, certain protein levels in the brain may increase. High protein levels are potentially associated with harmful inflammation in the brain. If stress hormones remain at high levels for an extended period, they can lead to inflammation in the body, potentially causing long-term health problems. Significant stress or trauma can lead to mental health disorders such as anxiety and depression. Therefore, individuals with untreated mental health issues are at a higher risk of turning to unhealthy coping mechanisms like alcohol and smoking. Listen to your child and observe them. Be present for them, and don't hesitate to seek professional support if you believe it's necessary.